David Burke, I am so excited to introduce you to Matteo Esposito. He has been a friend for many years and is one of the brightest young people I've met in a long time. And we have him on our Mind segment today because he's doing something I think you'll find really interesting. Matteo, can you share a little bit about the Invisible Challenge and what you're doing?
Sure. Well, first off, thank you so much for having me. Honored to be on. I would say Invisible Challenge is a mental health awareness brand with a very simple mission, which is end the stigma. We hope to do that by igniting change and normalizing conversations around mental illness.
Can you talk a little bit about when you were at Wesleyan, you and Danny Sorbs and a couple of guys were doing a project, and what came to your attention about athletes and mental health and men and just the way that mental health was viewed?
Yeah. Well, I think men, it's kind of commonly known, but still don't talk about mental illness maybe as much because they're supposed to tough it out, and especially athletes. And when you get to professional levels, they're seen as such high figures and maybe not even normal people. But when you look at two sides to both stories, they have struggles just like we do. So we started at school just realizing, one, through our own personal journeys, kind of inspired to help others, and wanted to reach out and show the two sides of every story.
Exactly. When you started interviewing people, when they started interviewing people, it was really cool because they talked to some pro athletes and some college athletes. And what surprised you the most?
Well, one very cool thing, which is kind of similar, we put out our best take at a trailer for the brand. We thought it definitely had some powerful moments. And what surprised me was how many people reached out saying, thank you for doing this. I've been struggling with X, Y, and Z for this many years. And, it's nice to see people being open and honest about topics like this. So it just goes to show you never know what someone's going through. And people who are in our hockey locker room, we didn't know they were battling, the mental illness that they were. So that was awesome to see.
Well, it's funny because a really good friend of mine is a physician. And when he says the worst, I don't want to say worst, but one of the most difficult patients is someone who says, I'm struggling with mental illness. He's got 2 or 3 minutes with a patient. He doesn't have time to deal with something like that. It's great for the awareness, but then where do the people go?
Right. Well, I think obviously professional help, whether that's psychiatry or meeting with a therapist and really taking care of things that we can't help with. But then there's also the piece of just community and recognizing you're not alone. Personally, it took me several years to do what was recommended for me. I was recommended in 2019 or 20 to get sober, and it took me 3 or 4 years to really not just admit that that's what I had to do, but accept all the changes I had to make to do that. So I think just turning to as many outlets as you can and trying to take this on not by yourself.
Matteo, do you mind sharing with our audience a little bit about your personal journey?
Sure. I'm smiling because I'm not sure where to begin. No, you go ahead, Debbie.
No, I was going to say, he's one of 4 kids. Go from there.
Yeah, sure. One of 4 kids, grew up an awesome life, great parents and supportive siblings. Mental illness, not really on my radar. Like, I knew people struggled, but until I was 19 or 20, didn't know much about it. Played junior hockey in Canada, and that's kind of when things started to spiral after playing for 4 teams in 5 months or so. Getting moved around, and then started to see depression and didn't know what it was. Saw a long manic episode of bipolar 1 disorder, and then depression after that. So it went on and off, and then self-medicating with substances. Didn't know a thing about addiction until I really was forced to go to treatment and learn to accept the changes I needed to make. But I think what got me through that was just not giving up. Like, it got as dark as it can get. Obviously, people have it worse than others. I always say there's no point in comparing struggles because even though someone's was maybe harder than mine on paper or easier, it doesn't take away what that person goes through. So I would say I got through it just with the community and the family, and just finally recognizing that I wasn't alone and I didn't have to take it on by myself.
It's interesting that alcohol was one of your choices because it's a depressant, and it further contributes to the downward spiral. And people think, oh, I'm gonna grab a bottle though to alleviate the pain, and it just makes things worse.
Or cannabis.
Right.
I mean, it's really pretty interesting. So moving forward now, what are you hoping to do with the Invisible Challenge?
So I would say we're definitely still in the early stages. So whether, we go all the routes we've thought of, or whether that's apparel with powerful icons and symbols that represent what we stand for, or a podcast or an app or community where whether that's a website or an app where people can share their stories and connect. I think our goal, along with myself and Danny, we want to make a huge impact, but at the same time, as we're just starting out, if we can impact one person's life, and have that person realize they're not alone and not give up, reach out to us or to a family member, and finally say, wow, I stopped isolating. I stopped trying to take this on by myself. And the name Invisible Challenge might seem obvious, but to others, what does that mean? Well, you can't see mental illness. Sometimes signs of struggle are clear, but when someone's battling by themselves and you look at their smile, you don't know what's on the other side of that. So I think exposing that other side and allowing people to share openly, whether that's reading the letter I wrote or 10 others, and being inspired to do it themselves.
It's wonderful to talk to you. And kind of in conclusion, do you still have your share of struggles? And how do you deal with it when you're kind of feeling yuck?
I was sort of expecting that question, actually. It's like sort of feels. I was thinking about that this morning. I definitely do. Not using substances or drinking has made it a lot simpler. Sometimes can be boring, but just had to happen is worth it. So the bipolar disorder piece, very much under control, essentially required to take medication, which I've accepted and do the right way. Obsessive compulsive disorder, which I've had diagnosed a little more recently, definitely impacts my functioning, anxiety, stress, sleep, waking up in the morning, struggling to keep the motivation to exercise. It's definitely gotten easier and more manageable, where for a long time it was so far from manageable. I try to do, when I first got sober in January of 23, I embraced it, and like I said, I keep using that word acceptance, not just admitting what I had to do, but accepting and making all the changes that needed to be made. So when that first happened, I tried to literally do anything and everything that was recommended to me, because my own way had not been working for a very long time. And now I do little things like cold water exposure, meeting with a therapist and keeping up with my psychiatry medication, trying to exercise as much as possible, because not just the physical benefits, but I know there are mental health benefits that I see. Just kind of keeping up with daily stuff, whether that's meditation or breathing exercises, and just whether there are struggles or not, doing my best to make them manageable, that I can continue to function and live a happy life.
I think you are a role model. It's so fun to talk to you, Matteo. It really is. I appreciate you very much sharing your story with us, and we are very happy to see him mind his health.
Mind your health, mind your health, mind your health, mind your health.
You know, David, doing a segment about muscle is always one of my favorites. And Tanya Colucci is joining us today here on Mind Your Health to talk a little bit about, is it fascia that's around the muscle? Talk to us about what you do.
Yeah, so I do a form of body work called myofascial release therapy. So the fascia is the connective tissue that goes throughout our entire body. So it's the outer layer of every cell. And inside those fibers is a gel-like substance that's called ground substance. And when it's healthy, it's very jelly-like and soft. So, the way I explain it to clients, not that way. But we can imagine, like, it wraps around microscopic muscle fibers. The fascia is around our organs. It's everywhere in our body. So over time, that gel-like substance starts to solidify and harden. So, when you feel like your neck is tight and you're like, oh, there's a knot there, it's hard. It's not that the actual muscle itself is tight. It's that connective tissue with the ground substance has started to solidify from the inflammatory process in the body. And when that starts to harden, it's literally strangling the muscle tissue with thousands of pounds of force per square inch.
So why do some people's fascia strangle the muscle? Is that the right question?
Yep. It's just the natural process in the body. So anything that I do, my short answer is life.
Okay.
So anything that I do with my body that's repetitive, whether I'm active or sedentary, the body tries to make it as easy as possible. So if I'm sitting like this all day on a computer, it's going to start to mold my body to this shape to conserve resources. So it starts to lay down layers of tightness. But also, it's impossible to separate the physical body from the mind, the emotion, or our energetic body. So when we experience various traumas or emotions, a lot of times we push those down in our body, and that gets stored in the fascial tissue.
Oh, stress and anxiety have a little bit to
Stress
play.
and anxiety. And one important key, I've been doing this work for almost like 20 years now. And we can have a chronic issue like chronic back pain or neck pain or even digestive issues. And until that tissue all around those structures gets released, it's going to continue to cause problems. There's a physical component to it. That tissue is tight, but also it's typically rooted in some suppression of emotions or patterns in the body that our body has started to model based on subconscious patterns as well.
So that fits in perfectly what we're talking about minding your health, how you use your mind. So tell us about what do we need to do mentally and what do we need to do physically?
Right. So the physical part is when I work with clients, I give them, not only am I applying the pressure to the body to release the tissues, but I give them like a therapy ball where they can actually do self-treatment on their own every day. And I think the biggest key is getting people out of their mind and into their body to actually move into their feeling senses. So one analogy that I use is like, if you've ever been hurt by somebody, whether a friend talked bad about you or, when you were dating, and someone broke up with you, it was like this gut wrenching, like someone is twisting your stomach or punching you in the stomach. And that is a visceral experience of that emotion of hurt, pain, sadness, anger.
Me taking your words, not letting you get a sentence in.
But, society, like as a man maybe, and depending on how you were raised, it wasn't really okay for you to feel those emotions and emote in the moment where you were having that experience, whether through crying or, expressing anger, verbally. So we push it down in our body because we can't, it's not safe.
Right,
to
it's
emote.
not safe.
Yeah. And so then every year that's just getting tighter and tighter and twisting more and more, and then maybe you've got issues or that's pulling on your back and causing back pain. And so I like to get people to tune into themselves and move their feeling senses into their body so they can actually start to feel and go into those physical sensations, which will typically lead to some type of an emotional release too.
What does the physical piece of your treatment look like? What would I notice?
So typically I have people minimally clothed. So like for females, sports bras and shorts, men wearing like athletic shorts. And I apply pressure with my hands into the areas that are tight after I do a visual assessment of you standing and your posture and your alignment, because that will guide me as to where you're holding the most tightness.
Okay.
And it's a very light to moderate pressure. And as I sink my hands into your body, kind of like holding silly putty that's cold, it's really hard and rigid. So I can feel that hardness. And then as your body starts to soften, it actually pulls me in deeper with more pressure. And so I'm holding releases for multiple minutes until that tissue can actually let go and release.
Is it a massage? Is it a pushing thing, or is it more
pushing, like compression with my hands? So I use my hands a lot to apply pressure. I do cross hand releases where I'm pressing down and then stretching my hands away to create an openness. I might also use my elbow in tougher areas.
How is it different than massage?
So we're not using any oils.
Okay.
Or sliding and gliding on the body. So in order to get that tissue to release, I have to anchor myself down into your tissues. So I'm pushing down into your body. And fascia doesn't really release until after about 90 seconds. And scientifically, there's actually a piezoelectric response that happens on a cellular level.
Got it.
Through the compression and the heat from my hands. It actually starts to warm up that gel-like substance and it starts to soften. And then after about 2 or 3 minutes of holding pressure in an area, so it's a longer period of time than I'm holding manual release, the body actually releases a natural anti-inflammatory hormone called interleukin-8
Yes.
to the area. It rushes to the area. And so it helps to start to decrease the inflammation, which is what's causing the physical stuckness in that area.
Is there one part of your body more susceptible to issues like that than others?
I would say yes and no. So I look at everyone standing, and everyone's body is unique in how it lays down patterns of tightness. So even if I had 10 people with back pain, there's going to be similar areas that are going to be tight, yes, but there's going to be differences too in how your body lays down tightness. But I would say the main 3 areas that most people are tight would be their psoas muscle, which is one of the hip flexors in the lower abdomen.
Oh.
That's our fight or flight muscle. And that pulls on the back
Yeah.
and causes issues through the abdominal area. And then that comes up into your diaphragm, which most people are tight here in the
Yeah.
solar plexus and diaphragm. They can't even take a deep breath. The piriformis in the back, the buttocks muscles is where we hold and grip a lot, and then in the jaw, which then results in a lot of neck tightness and
Never thought
shoulder
about
tightness.
that. Yeah.
So those would be 3 key areas. And then most of us are sitting a lot, so the chest is very tight, and that causes tension in the upper back. So those are typically key areas that I try to.
When people go to you or go to someone like you for treatment, is it a series of treatments? Is it like an assessment or an intake and then a treatment plan?
Yeah, so I do a very detailed health intake, and then I also have a lot of questions on there about trauma as well, because what their past experiences have been. But I do postural assessment. So typically most people that come to me that have chronic issues, they do have an imbalance in their pelvis. So one side is higher or rotated than the other. So I work to balance that out. And really every day when the client comes in, I do a postural assessment to see how their
Okay.
body has adjusted and realigned. Typically in the beginning with opening the fascial system, repetition is important because you build up these patterns in your body for decades. So I usually start with 4 to 6 sessions close together, like once a week. And then as the body opens up and the client's doing the homework that I give them, then we start to spread the sessions out to every 2 weeks, 3 weeks. And then from that point, once their symptoms are gone or go away, they go to a maintenance plan.
And so for you in the pharmacy, well, no, as a pharmacist, I mean, you talk about inflammation all the time. And that's
Constantly.
sort of what you're talking about
Yep.
as a way to counter that or as a way to disperse the inflammation, prevent it?
Fascial tightness in the body is really an inflammatory process. And so that can be caused underlying by stress, also what we're doing with our body or not doing with our body. And when that tissue is tight, it's compressing all the joints in our body. And so that's causing the inflammatory process of arthritis.
Okay.
Or even, even gut issues.
Interesting.
Yes.
Yeah.
You've got an 11-year-old, I know that.
Yes.
So for kids, you've got 2 new grandchildren. And,
I do.
Right? For kids, is there a way to kind of prevent this or for us to pay attention to it as parents or grandparents?
Yes, we actually start developing fascial restrictions in utero in the mom's belly.
Wow.
Because
Oh.
it's 2 cells are expanding, coming together and expanding from the fascial system. So it is what starts everything. And so really it's ideal if a mom and a baby get treated right away because the birthing process is actually the first trauma
Sure.
that kids go through.
Exactly.
But kids have patterns in their body, so I work on kids from infants all the way up to, I think my oldest client is in his 90s. So,
That's so interesting.
and everyone in between, yeah. And so with kids and even infants, even some of the reflux that they'll have,
Wow.
the inability to self-soothe, nursing issues, sometimes it's coming from
Yeah,
their jaw
yep.
and how their head and neck was torqued through the birthing process. My son is a very active baseball player, so I'm working on him, and as he's growing and his body is stretching, a lot of times the fascia is already restricted and tight, and they'll have growing pains. So the more open you can keep their body, the easier that process of
I tell you what, we learn
growth
something
is.
every day.
Isn't that the truth?
Thank you so much. This
Yeah.
is a great way to teach us how to.
Mind your health.
Mind your health, mind your health, mind your health, mind your health.
One of the things that David and I are really proud of here on Mind Your Health is we are starting a book club, and it's a Mind Your Health book club. And we can't wait to show off the book that you're in, because that'll be a really great one. But Brett is here today, and he suggests that he does all of our social media and works here with the Mind Your Health team. And one of the books that you suggested is Rewire Your Anxious Brain by Katherine Pittman. And just to be real transparent, you had a little bit of anxiety a few years ago. And tell us how this book kind of helped you. What did you learn?
Yeah, I mean, I still have anxiety being on here and anything, but this book really takes you through start to finish what anxiety is. It's broken up into parts where the beginning is more scientific, teaches you about the brain and what anxiety is, where it comes from, and it helps you understand your own anxiety. As you're reading and learning about it, you're like, oh, that's when that is for me, and that's when I pick up on it, and then it goes into how to help you deal with it and different techniques. And
so what are you doing now to deal with it on TV?
Breathing and doing it anyway.
Exactly. I always have to laugh. You correct me every single time I box breathe incorrectly and things like that. Have you ever had anxiety?
I'm not an anxious person. I grew up in a large family. I was one of the younger children, so I had to deal with a lot of issues. So I don't. So I certainly understand it, and I have anxious people in my circle of life. So, but
you do?
I do. You'd be surprised. I know. President COVID excluded.
We okay? We okay?
This also fits into what we were talking about, how some of these brain issues of anxiety and stress and panic then affect your blood pressure, they affect your digestion, the whole gamut.
One of the things when we first started talking about this, is there really an intersection between what David does in pharmacy and what I do, from a therapy point of view? And it really is for all of us.
Yeah.
Tummy
definitely.
aches, things like that. We were talking to Heather, who's also here, one of the members of the team. And we were talking about anxiety and stress and how you manage it. It's pretty interesting. So we thought these books every month might be a great way to have a resource that you can put your hands on and take a look through. I will testify to the Katherine Pittman book because as a psychologist, we know that you can rewire your brain. We know that you can learn skills and techniques to kind of settle down that stress. And having something to refer to is really, really healthy.
Yeah.
So we thought yes, exactly.
Yeah, I agree. Yeah.
So we thought it would be fun every month to do a book of the month on Mind Your Health.
And remember, we're receiving no financial remuneration for this book. Check it out. It's a great book, great help.
Mind Your Health.
Mind your health, mind your health, mind your health, mind your health.
This episode of Mind Your Health is brought to you by Burke's Pharmacy on Hilton Head Island, where the locals go for a reason.
That's right. Burke's isn't just a pharmacy. We're like family. Whether it's a quick prescription pickup or advice on staying healthy, we've got your back.
And they've been doing it for over 30 years. From vitamins to vaccinations, Burke's has everything you need to stay well. Always with that local care you won't find anywhere else.
So swing by Burke's Pharmacy on Hilton Head Island, where we know your name and care about your health like family should.
Mind your health, mind your health, mind your health, mind your health.
Today's Mind Your Health podcast is about pharmacy compounding. I'd like to introduce Ryan Rosenblatt. Ryan is a doctor of pharmacy from the Medical University of South Carolina and is an expert in compounding. Ryan, what's the difference of traditional, I need 30 tablets of this, count them out, go for blood pressure, to some of the hand-picked compounded medications?
Yeah, the most distinct difference is the customization available for a compounded prescription. Most commonly, we're doing things that if there's an ingredient in a traditional tablet that people don't tolerate, whether that be a dye or some filler, we can make a medicine that has none of that in it and just the active pharmaceutical ingredient or API. Also, alternative dosage forms are sometimes necessary for people maybe can't swallow a pill, or for children, or for animals. So those are the main kind of distinctions for compounding even if it's for the same indication or the same medicine.
Well, and I want to even ask a more basic. This is your business, so all of this terminology is pretty familiar to you. I think I kind of want to know what compounding means, to be honest with you.
Sure. So prior to like the big industry of pharmaceutical industry creating tablets in mass quantities, pharmacy started as making pills and rolling pills and having the active ingredient, whether that be some herbal supplement or something, before we really had the science that made today's modern medicine.
My father rolled pills by hand.
Yeah.
I remember
Does he really?
Did. I remember as a kid watching him roll pills by hand. They were powders in a waxy substance, and he'd roll it into a ball.
When my grandfather's father owned an apothecary, was that what it was called? And I have apothecary jars that are like 150 years old. Is that what you're talking about? Is that where the...
No, that's what I'm going to talk about, coming into your house at night and taking them.
Oh, yeah, well...
David collects stuff like that.
Yeah, you have to see them. You would have a heart... They are so... It's just so interesting.
Yeah. So that's kind of the origin of practice of pharmacy. Then mid 20th century into now, they created the mass production of the pharmaceutical industry. But, essentially, there's still a need in some cases for people to go back to those traditions where we make a suspension, we make a suppository, we make even capsules today. We have encapsulation machines. But
topical, I guess.
We can do topical creams. Yeah, there's a lot of options.
Interesting.
And the biggest thing would be we use active ingredients that are 100% pure, name your drug, and we do the math to find out how much to add to the cream or the suspension, and we make that for each individual patient.
And typically, do doctors have a prescription? They're saying, okay, Debbie, you need this, 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 and this, and there's no real pill out there for it, and then I go to you, and then you formulate?
Essentially, that's how it works today.
Okay.
It is a specialized or niche thing. There's a lot of independent pharmacies that are compounding pharmacies, but it's very rare to have a Walgreens or CVS or a big box company that has it. Some of them do have single locations that compound, but most of them kind of bypass doing that.
Okay.
And so it leaves it to the independent pharmacies to provide that extra level of service that local doctors and local patients can enjoy.
Well, it's so funny. As a woman, hormones are always a big one, where it would be like, maybe I need a tad of this and a titch of that, or...
Sure. So
I have Newt.
So that's one of the most popular things we compound at Berks.
Okay.
Is hormone replacement therapy.
Okay.
So there's several doctors on the island and in the area that prescribe, and it's something that's done around the country regularly. Depending on your needs or your symptoms, the doctor usually drives the boat on what the dose is.
Okay.
But pharmacists can assist in kind of pushing those limits and saying, oh, this drug, we can only do so much, or that's beyond the normal limits. So we do participate, but for compounding, there has to be a triangle of patient, doctor, and pharmacist or pharmacy. There has to be a prescription and a need for us to fulfill that.
One of the things that David is teaching us, and we talk about all the time, is kind of how to develop a relationship with your pharmacist and how important that really is. And that would be a perfect example. If I came into you and I'm saying I'm having these symptoms, my doctor says we can only do this. It's something that you might say, if we add a little eye of Newt.
Well, unfortunately, we don't have prescriptive authority as pharmacists, so that's that separation of powers.
Okay.
So I could maybe make a friendly suggestion or tell you what I offer.
Sure.
But it's not something that I could say, you need to turn around and tell your doctor this is what you have to do, because there has to be that relationship between the doctor and the pharmacist.
With the exception of that is, hey, my husband is having trouble swallowing this tablet. We might be able to make it into a liquid or a capsule.
Okay.
My dog won't eat this medicine. We can put it in a treat, in a gummy. We can. There are lots of things to do.
Do you realize what you just said is that you can,
Yes.
well, I'm just listening, and I actually listen. And I'm hearing that you can help animals, too. So you could compound medicine for my dog who can't do this, or my cat who is like, no, I'm just not eating anything.
Yeah, we even have a specialty thing that's called a chew a treat. That is essentially a custom-made dog treat that we can put medicine in. And so the animal doesn't even know they're taking medicine. They can chew it just like they would chew a bacon bits or something like that.
I mean, that's crazy.
I want to get back to the hormone replacement. It's usually done woman goes into the OBGYN, and then either a spit test or a blood test is done.
Okay.
And that's going to say exactly what you're either low or high on. So
Got
it's
it.
individual.
Okay.
This compound right here is for Debbie Lyons.
Okay,
it's
got
not
it.
for her
Whoever,
sister, or
just-
it's not for
right,
her
okay,
cousin.
okay.
They're so individualized based on your lab value. That's really important.
Yeah.
How
Go ahead.
about if I'm explain to how it works if I'm on some very expensive medicine, I'm like, I don't want to pay that money. Can you compound? I'm on Eliquis and it's $1,500 a bottle.
Look at him look at
And
you.
we get this kind of question a lot. It's
Okay.
something that is intuitive that, hey, can you make this custom for me? Unfortunately, we can't copy something that's commercially available. If that would be bypassing A, their patents, and B, the regulatory circumstances.
Yeah.
So we do have to have a customization. So like I said before, if there's some dye that's only, you can't bypass having a dye that you're allergic to in an expensive medicine,
Gotta
then
be creative.
well, but it's also
Yeah.
based in truth.
Sure.
If Pfizer's not going to change their thing that they make billions of tablets of just for one person, but a pharmacy could potentially help with that and compound your dose.
See, that makes so much
in its
sense.
own way.
I do a lot with eating disorders, and semaglutides, the semaglutides now seem to be a big thing that are being compounded specifically for people. Are you seeing a lot of that?
Absolutely, and so that's another interesting caveat. So when things are considered on shortage, a manufacturer shortage, and that is kind of monitored by the American Health Systems Pharmacy
Yes.
Association and the FDA, if they get put on like an official shortage list, that kind of opens the doors for pharmacies to compound them to make up that missing market
So that's
share.
the semaglutide thing. It's like, okay, we can't get Wegovy right now. We can't get this. Adderall, is that another one that is?
At a certain point in time, that probably was something that would be allowed, but that's a Schedule II drug, and so
Okay,
we
got it.
typically don't compound to that. Just it's a higher risk, and it's more prone to abuse or something like that. So we
One
don't
of these
usually go
days,
down
we
that.
need to get him talk about things like Schedule 1, Schedule 2, Schedule 3 drugs. I think that's really can be interesting and confusing.
Well, it is. Most of them are just medicines, but along the path of their being created or being discovered, it was found in one of their trials or something that people either had a dependency or habit forming. So the DEA started to classify medicines, and so it's not that one's worse than the other. It's just that they keep a more watchful eye on the supplies.
I think the magic word is potential for abuse.
Right.
Oh, okay.
So Schedule
I got it.
2s have the most potential.
I
They go
got
from
it.
down there. And Schedule 1s are no known medical use. Heroin would be a Schedule of 1.
Okay, I got it. No known medical use. And
Correct.
that makes perfect
Correct.
sense. I think it's really interesting. Again, eating disorders, a psychologist, so attention deficit hyperactivity disorder. I didn't realize that some of the medicines have something that it won't dissolve until it gets into your stomach, or it's one. Tell us a little bit about how some of these things creatively work.
Yeah, so that's some of the brilliant minds that work in these drug companies. They have come up with all sorts of different time release, extended release.
Yeah.
Each company kind of has their own terminology, but essentially what they do is they either use the chemistry of your GI tract to time when it should release. They also use the chemistry of your blood, like Vyvanse, for instance,
Yeah.
is absorbed but is not activated until esterases in your blood turn it on, so to speak.
So interesting. I mean, it's so interesting. Do you feel like you learn something every day too?
Ryan teaches me every day.
Well, it is different.
No, I totally agree. Especially, I graduated in '85. When did you graduate?
2020.
So
Oh, there
he has
you
35
go.
years on me.
Well, if we learn nothing else, the pharmacy is a great way to.
Mind your health.
Mind your health, mind your health, mind your health, mind your health.
Today's Mind Your Health podcast is with Celia with Dancing Hammock to talk about Pilates and how that can help your overall health.
And you're so excited about this. He's like,
Oh, I'm ready. I'm a Pilates guy.
you're
gotta
a
get him on
Pilates
the
guy?
machines any day now.
But are you a dancing hammock guy?
You'd be
Well,
surprised what I am.
We'll find out,
Yeah,
right,
do
David?
tell. Celia, thank you so much for joining us. I've had the opportunity of doing a dancing hammock. It was super fun.
Yep, we got Debbie upside down.
Yeah, exactly. And
I have a hammock. Does that count?
No, that does not count.
Is it on your porch?
Yes.
Yeah.
You grew up dancing.
I did.
And body alignment and just body movement has been always a passion of yours, and health
Yeah.
and wellness. So you're perfect for the muscle segment of Mind Your Health. Let's talk a bit, if we can, about Pilates and what it is and why it's so important for your overall health and wellness.
Well, I'd like to also say Pilates, but any movement is really good for your overall health
Darn
and
it.
wellness,
Yeah,
right?
we'll
I mean,
learn that lesson
any
again.
movement. And honestly, Pilates has evolved a bit. If you're going to go for the classical, Pilates, I probably can't speak a ton about that because I learned more of a contemporary approach, learned more basically like muscle science, and that has even since evolved to just like, well, if you want to get stronger, you have to load your muscles, and we, as personally Pilates instructor, I use Pilates exercises to help with that. But Pilates is about your core. It's about understanding how your body moves and how you move it intentionally. Like when you walk down the street, if you don't know you're walking with one shoulder, half a inch cocked lower than the other. I mean, Pilates does help your imbalances, and instructors are able to see, it's like, did you know that you have one hip completely twisted forward than the other? Oh, no, I didn't. How can we fix that? Well, do more Pilates, do more movement, do more even movement. So,
Do you think dance got you started in just
Yeah,
understanding
absolutely.
your body mechanics?
I can definitely say that dance has a lot of, in my brain, history of like what the eye of form is.
Okay.
When you look at a dancer, I'm sorry, I have to be biased, but ballet dancers, if well trained, have the best form. They check all the boxes for
I'm looking at Lily over here.
endurance, posture, strength, stamina, cardiovascular output. A ballet dancer will check every single one. Flexibility, balance, all those things.
I hear this core word used a lot. And help
What
us.
is a core?
Yeah,
What's your core?
Maybe that's the best thing to
Well,
ask.
Joseph Pilates defined it as your powerhouse, which not only included your muscles of your abdominal wall, but also your inner thighs, and your glutes. So thinking about your powerhouse, and what we also learned a little bit more in how we've evolved with exercise science is that you do have to kind of engage. It's not just like brace your muscles, right? And try to just clench.
Like I'm squishing my muscles right now.
I teach that you can tighten your muscles with your breath, with your exhale, but I also think that you can do it with a movement, right? You could pick up a 25-pound weight and you can try to curl it up and you're going to use your abs, but sometimes it just depends, I think, how much that body needs. Like if you got injuries, then there's certain ways that you're going to exercise your muscles, that you are going to move certain ways and not certain ways, if that makes sense.
Well, one of the things that we've learned that I was interested in is how your body over time adjusts to what you're doing. If you stand, I stand up all day, and I'm usually over a computer keyboard.
Right.
And my body's adjusting to me standing all the day, and I'm out of alignment. I didn't even know I was out of alignment because I've so adjusted to what I'm doing.
And I could be wrong about this because I just learned about it recently, but it's called the SAID principle, S-A-I-D, and forgive me, I don't remember all the
acronym,
but it's something about adjusting for imposed demand. So your body is going to basically adjust. It's always going to try to do the most efficient thing. So if you were, whatever you do, it's going to try to do it as best as possible. That doesn't mean with best posture. That just means as efficiently, from a straight line from A to B. So if you're sitting at your computer desk and you're sitting like this, well, it's a little bit easier than sitting up straighter because straighter is kind of harder. So that SAID principle is going to sometimes be a challenge, I think.
I learned, go ahead.
Well, we learned that too. It's about conserving resources.
Correct.
My body's going to do as little as possible to save that energy in case I need to run from an animal or run from my neighbors.
Right, the woolly mammoth or something.
So what do you recommend for people? Do you recommend Pilates? You also have dancing hammock. You do a lot of other kinds of, is it training? Is it fitness? Is it movement? Is it exercise?
I think it's so unique. Like, I was never a huge gym goer. I don't want to really admit that. I was a dancer, and then I got into the outdoor field. I think it's really important that you recognize what speaks to you. Like if someone doesn't want to go lift a bunch of weights because it hurts, or maybe because they don't want to be in a gym with a bunch of other sweaty people, then well, they need to find another way to add load to their muscles, to find something that helps them move, as long as you're not sedentary. But yes, Pilates is great. But so is, if you can run and not hurt yourself, great, go for a run. You know, I like to jump on a trampoline. I like to hang in a hammock. I created dancing.
I can do that one.
I created dancing hammock because I thought exercise needed to be fun, and it needed to be something that you enjoy and not feel like oh God, I got to go exercise today. And I'm human. There's days I'm just like, please give me a glass of wine. I want to sit on the couch.
Right.
But I don't always say, okay, I'm going to go do something. But, you know, when we do, you feel better. You feel better.
Tell David about the hammock, what that really does, because that's kind of a fun movement.
It is fun.
I stopped listening when you said you were upside down.
As well you should have. She about had a heart attack. She was like, she's going to die.
I was afraid she was literally going to fall out. But if taught correctly, it's about decompression. Now, if your spine has been if you're used to gravity pulling you down this way for 24 hours a day, maybe except for when you're sleeping, and then you flip upside down the other way, it's going to be a bit of a shock. So I definitely encourage people to take it a little bit at a time. We don't do more than 2 or 3 inversions for like 2 or 3 minutes at a time. Inversions. Straight upside down. But, you know, if you have spinal issues, scoliosis, or if you've had recent surgeries, you can do it more gently. There's a few different ways. You don't have to necessarily go straight upside down. But that is, I believe, we have to fight gravity. We're all getting older. I'm getting older. I'm starting to notice things changing and not staying strong. You know, things hurt more, right? And if you can find exercises fun, if you can decompress your discs, add hydration to your discs, I think, and it's proven. And then the trampoline?
Yeah,
I
tell me
mean,
about
the
that.
astronauts did that when they came back from space, right? It gave them like a more concentrated foundation or movement that was a decompression. It was anti-gravity. It was the acceleration, the deceleration cancel each other out.
Okay.
And they were able to get more strength and also maybe just retrain their brain because they were,
Like
with
a
no
little
gravity.
trampoline?
Yeah, it's about a little bit smaller than this,
Yeah,
for sure.
exactly.
It's like but I use really nice ones called Bellicon. They're made in Germany. They're bungee based. You can choose the strength of your bungee.
Tension.
So, and of course, we always use a T-bar and handle because I don't let anybody get on there without it. And it's really just a great warm-up. 10, 15 minutes on the trampoline, get your lymphatic system going. You drain out all the crud.
What do you think we should do as far as movement every single day?
Right now?
Something? No, Lord, no.
Can I get you jumping the trampoline?
We're not going upside down.
Lord.
What should we do every day?
I mean, do you think people should do some form of movement every day?
Yes, absolutely. Yeah. I mean, if I can do 5 minutes on the trampoline in the morning before after I get out of bed and, go to the bathroom, things like that, 5-10 minutes just gets juices flowing, hang upside down for another couple minutes, and then I'm off. I don't always have a lot of time.
So is that literally just jumping up and down for 5 or 10 minutes?
Jumping jacks, focus on staying upright, not like let my head fall forward. Yeah, literally jumping jacks, twisting, jogging, sprinting, just moving and getting the body going.
At any age, for any
At
stage in
any
life?
age. Honestly, it's so much better than running down the street. I mean, I ran last night for the first time in a little while. And, and I'm still going, gosh, that kind of hurt,
Yeah.
But I know I need to do it because, again, you still have to add load to your body or you can have a 70-year, I just saw on some Instagram post that I follow, but he had like a dissection of like a triathlete's thigh.
Okay.
Which looked like a beautiful piece of steak, right?
Okay, all right.
With, muscle, very little fat and a bone. That was like a 40-year-old triathlete or 30-year-old triathlete. And then like, a 70-year-old sedentary man, mostly adipose tissue, some red in there, and then the bone.
Okay.
And then they had a picture of a 70-year-old triathlete. Looked exactly like the 40-year-old. It's just what you have to keep adding it. You have to keep loading, and your body does change. So, I'm no PhD of any of this, but I see lots of bodies change, and they're all like, how do we stay strong? You got to keep challenging those muscles. You can't just keep it plateaued.
And I'm sure it's relative, starting with, if you're an older person, you start with
Absolutely.
1 pound, then you go to 2 pounds.
And then you have to be careful because at that point, your soft tissue may not be able to support.
Well, that's a good point too.
All the muscular load, but you progressively load it, and then you start getting it to where it's like not as hard. And okay, well, I can handle 2 pounds and maybe 5.
So at the end of the day, what she's taught us a lot is a great way to
mind your health.
Mind your health.
Mind your health, mind your health, mind your health, mind your health.
Welcome to Mind Your Health. We are here today, David, with my friend, Dr. John Daniels. It's great to talk with you. He is a pulmonologist, and I think it's really interesting. With Mind Your Health, we're talking about mind, muscle, mouth, and medicine. And I think we talk all the time about how you can't really separate your brain, from your body. Everything works so collaboratively, if you will. And thought it might be interesting today to chat with you a little bit about what you do as a pulmonologist, because I think it's not at all what people think.
Right. We're super busy.
Yeah.
Started with our practice spans the whole gamut of pulmonary problems, inpatient issues all the way to multiple outpatient issues, sleep medicine's also included. So we may follow you outpatient for, say, COPD or asthma.
Oh, COPD, asthma. Okay, that's what I want to know.
Those are big components of the practice. Yeah. COPD, asthma, fibrotic change of the lung, interstitial lung disease, pneumonias, allergen-induced asthma issues are another big component here.
Okay.
So those are primarily what we see in the office, in addition to the sleep that which is a large component, probably 35 to 40% at least of our practice of sleep medicine, obstructive sleep apnea, central sleep apnea, and other sleep disorders. So we do that on a day-to-day basis, as well as if some unfortunate event occurred, you end up in the hospital with respiratory issues, we cover you there as well, and see people with significant pneumonias, respiratory failure from multiple different causes, and advancing disease.
What was it that intrigued you about the pulmonology field? See, don't you always want to know why these guys go into what they do?
No.
Yeah.
You gotta love David. I mean,
Yeah.
I would love. This curious mind wants to know.
You know, I started out liking critical care a lot.
There you
so
go.
you get people come in, they're quite sick, and you get you treat them, and you get to see a lot of significant improvement in short periods of time, and really see people go from being in a bad condition to improving, getting back home, and really getting through difficult issues. And so it's a good feeling to be part of that and be able to help people out when they really have some significant medical issues. So I started out with that, and then you sort of transition into more pulmonary as people get discharged from the hospital, they get better, they need somebody to follow along, try to keep them healthy and keep them back, or keep them from getting back in the hospital with the same condition, and make sure they stay on a good path.
Go ahead.
One of the things, a couple of things I want to touch on that you said is, especially about pneumonia. So I'm a pharmacist, and at retail pharmacy we do a pneumonia vaccine. Can you speak to that for just 2 seconds here? You're a big believer in the pneumonia vaccine.
Absolutely.
Recommend it all your patients.
You made me get that.
Yeah.
Made is a strong word.
Okay.
Yeah, definitely recommend it to everybody.
Yes,
It's
he did.
appropriate for generally in our aging population here in Hilton Head. The vast majority of people are going to need the pneumonia vaccine.
Okay.
Certainly send people to the pharmacy all the time to get it, and a big component of trying to stay healthy and keep most of the common pneumonias at bay.
What is pneumonia?
So multiple different types of pneumonia. Generally, when people are talking about pneumonia, they're thinking of an infectious pneumonia.
Yeah.
So bacteria, viral pneumonias are also common. And we saw, of course, with COVID, COVID pneumonias is a type of bacterial, or I'm sorry, type of viral pneumonia
Right.
that has been real on the forefront here lately. So an infectious pneumonia is what we typically would see treated with antibiotics, potentially antivirals in the case of, say, influenza, for instance.
But we get our flu shots, so we don't have to worry.
There you go. Different types of inflammatory pneumonias that we see quite frequently in pulmonary practice as well. So if you end up with what is likely an infectious pneumonia, it gets treated, it's not getting better, then we have to start thinking outside of the box on different types of pneumonias that are non-infectious.
David and I talk all the time. You're on a CPAP. We talk about sleep. For me, people who don't have good sleep, it affects them cognitively. I mean, there's a litany of areas that it really affects. Has your practice really embraced improving our sleep as something that's important?
And before you do that, so explain the difference between being apneic.
Okay.
So I was a snorer, and my wife said, "Look, either the other room or get fixed." So I never stopped breathing. I just was a mouth breather, and I would snore,
Sure.
loudly. Explain the differences there.
Yeah,
'cause
good, that's a good question.
I did the sleep study, and I like I said, I wasn't apneic, but I benefited tremendously from the machine.
Sure. Yeah, so snoring is a very common problem. And many times it's secondary to obstructive sleep apnea, but you certainly can snore and not have obstructive sleep apnea as a
And that's what you
diagnosis.
did. You snored but didn't have obstructive sleep apnea.
Well, it's right. My heart didn't stop. Wasn't skipping any beats and
Right.
that kind of thing.
So what we're looking for in that, so a lot of people come in, they're snoring. Most of those people are going to have some obstructive sleep apnea. And obstructive sleep apnea is when you fall asleep, the tissues in your throat and the back of your mouth, your soft palate, and other tissues relax. They fall back into the airway and essentially block the airway. So when you're sleeping and you're trying to take a breath, your airway is obstructed.
Oh.
You sort of tug and pull and try to take a good breath, and you can't get any air in. Because that airway is obstructed. Eventually, you're going to break that seal with enough effort, and you get rattling or vibration of the tissues as the air passes, then creates a snore. So many times that snore is related to the airway sort of opening up when you put enough effort in. Sinus issues or nasal rhinosinusitis and
yeah, that makes
inflammatory
sense.
change
Yeah.
in the nose and airway can also lead to some obstruction in the airway, and that can cause snoring a lot of times where you're not actually having apneas.
See, that was me. So I had really bad chronic allergies as a kid,
Okay.
and I had sinus films done, and I'm all overgrown in tissue, all in those sinuses.
Is it typical that your wife or your spouse is the one who tells you that you were snoring? I mean, gets you to the doctor?
More frequently than not, yes. Yeah.
You're treading on dangerous ground here.
Oh, we are?
Yeah,
Well, no, I
absolutely.
wondered, is it like, kind of
No,
bugging me
yeah.
now?
Generally, we have it's generally the husband who's sent in by the wife for.
Really, is it?
Yeah, it's just you're snoring. The partner is just doesn't want to deal with it anymore, or people will have moved. They separated rooms for some number of months or
Yep.
years potentially because one partner was not sleeping well, and the person who's snoring eventually decides to come in and get checked out. And CPAP, if that's appropriate for you, which it is for most people with
Okay.
obstructive sleep apnea, it really takes care of the snoring immediately, and you're sleeping quietly. You can generally get back into your normal sleeping pattern with your spouse, and that person be comfortable being in bed with you.
So it's interesting, when I filled out the form, it was, do you wake up tired? Do you fall asleep easy during the day?
Are you
And
grumpy?
I was all, no. But then when I started the machine, I felt 200 times better.
Did you feel
Absolutely.
more
Yeah.
rested?
Absolutely. And I go to sleep like that, and I wake up, I'm good to go. And I hear a lot of people complaining about either mask but the technology with the plastics. I have the little air pillow. I don't feel a thing.
No, the
It's
nasal
the
pillows
most
are
comfortable
fantastic.
thing. Yep.
Yeah, I start most of my patients on those
Okay.
if it's seem to be appropriate for their case, but probably the vast majority of people I start on that. Most of them do great with it, tolerate it really well. Some people we may need to convert to a different style of mask if that's not doing the job, but it's really not. It's less invasive, not
Okay.
really problematic, I think, for most people. Because the bulk of plastic is minimal, and
Right.
it fits on your nose and holds in there comfortably.
Is obstructive sleep apnea more a guy thing, or is that just in my imagination?
More male predominant?
Yeah,
you think?
more male predominant.
Yeah, it tends to be a bit more male predominant, particularly in a bit earlier decades of life, 40s, 50s. As we start getting in our 60s and on, those numbers start to close in where
Oh,
the
darn.
prevalence becomes similar.
At what point does a person go to a pulmonologist? I've always,
That's a good
you
question.
go to a primary care doc, and then when do I come to you?
Sure. If there's significant issues that the primary doctor needs assistance with diagnosis or treatment, or needs testing that they don't have in their office. So pulmonary function testing is a big component of our
What's that
practice.
mean?
So how well your lungs are functioning?
Yep, how well your lungs are functioning. Come in, we have a pulmonary function testing PFT machine, and what we're doing is measuring inspiratory, expiratory flows, lung volumes, different capacities of the lung, how well oxygen diffuses through the lung membrane. So we pick up some small functioning or small abnormal functioning of the lungs on those pulmonary function tests that you may say, I'm short of breath, you're having difficulty figuring out why.
Short of breath, yeah.
You come in for the test and we say, well, you have a bit of obstructive airflow when you're exhaling, or perhaps you're not expanding your lungs well.
I've got a mind question to go with that now, to go with the pulmonary. People have panic attacks. I hear all the time, I'm short of breath, I can't get a deep breath, I can't get a deep breath. And I think for me, from a psychological point of view, I always want to rule out medical first.
Yeah, absolutely. I mean, I think that's certainly the way to go. It's chicken or the egg on that
Right.
from time to time. So some people actually have significant breathing problems or organic respiratory issues, and as they become short of breath, they become more and more anxious. So they have anxiety issues related to not
they
being
can't
able to
breathe,
breathe.
yeah.
It's certainly anxiety provoking. So ensuring that you don't have any underlying pulmonary or cardiopulmonary issues that are causing the shortness of breath is certainly the first step.
Even as we're sitting here talking, for me anyway, once I start paying attention to my breath, I feel like I'm shallow breathing.
I pay attention to your breath all the time. We're
That's
sitting
why I
nice
have
and close.
I have Tic Tacs and I keep them with me all the time. So
I want to talk about smoking for a minute.
Yeah.
I know where people that have stopped, pulmonary function will come back. Can you get back to when you were a
good question.
teenager, or can you, if you smoked for 20, 30 years, how long does the body take to cleanse itself, so to say?
Right. So from around age 35 on, we all lose lung function from aging. So when you're a smoker, you tend to lose, and by lung function, I'm talking about expiratory flows. So you tend to lose that at 3 to 4 times the rate that you would when you're a smoker as a non-smoker. So over the years, you lose this lung function, and most of that is not necessarily regainable. So what we see in our practice a lot, is people in they typically start smoking in their later teen years, 17, 18 years old, or historically have. They feel fine through their 20s, 30s, 40s, depending on the volume of cigarettes they're using. 55 to 60 is a spot where I see a lot of people showing up for the first time. They've been smokers since they were 18, let's say. 56, 57, they start saying, hey, I'm feeling short of breath. I don't know what this could be. And it's generally smoking related. Those years of damage have been done, and they're not readily reversible or entirely reversible.
You're a smoker?
No,
Oh.
I have a question. I have never ever had a cigarette ever.
Me neither.
You haven't either? But what's really interesting is I deal with adolescents all the time. Honestly, if I have 10 kids sitting here, 3 of them vape.
Right.
Between
That's what I was gonna-
vaping,
and the-
cannabis, all of that.
And the jewel.
Yeah, tell me the scoop on that, because I know that for all the young people who are, saying, I just smoke cannabis, I'll just do a joint, or blah, 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 or I have a vape, or whatever. How does all that,
Certainly,
what do you see?
the vape is, vaping a new issue over the last, probably 10 years
Right.
or less. I think we still have more and more data that's coming forward with that. Cigarette smoking is a habit I think a lot of people have picked up, and they can't continue on for decades and decades.
Got it.
I think we'll have to see how vaping plays out. I think that tends to be a shorter use issue, certainly important, but people maybe in their teens start to pick that up, and they use it maybe at some point in
I
their
see.
20s.
Got it.
And we don't, it's certainly important, and certainly something that we would like for people to not do. I don't know what the chronicity of that's going to look like when it's 30 years down the road if people continue
What
to do
about
it.
marijuana, though? Because I know it's really interesting in a lot of the talks that I do, and I'll go to Sun City or older populations. Shoot, they all grew up in the 60s. They're still smoking cannabis. And I wonder if that has any detrimental pulmonary effects.
So it can, and
Okay.
it really is going to depend on the volume of use. You know, when we compare it to cigarette smoke, it's I don't think it's anywhere in the same category
Okay.
because of the volume. You're not smoking 30 marijuana cigarettes a day or something
it.
like that. Whereas a lot of people smoking cigarettes tend to just go through a pack or 2 or 3 a day.
So I guess that is really where it's different.
Yeah, that was my father. My father would get up in the morning, light a cigarette, shower, come out, would smoke the same thing, and would smoke the entire time until he went to bed at night.
I think that's why none of us smoke, is because our parents smoked, and it was like you were in the station wagon with the windows rolled up, and it was like,
Yeah, absolutely. Different, a little bit different times,
Right.
fortunately. Marijuana smoke can have some effect, though, particularly in people with predisposed to asthma or that have asthma.
Okay.
Just the irritation from the intermittent smoke can certainly be a trigger, or ongoing chronic use can certainly cause some
Is there
problems.
anything more fun? This is why we love Mind Your Health, than having a pulmonologist like stuck in an interview position where we can ask him any question that we've all wanted to know the answer to. And now he's like, I just got to answer each one of these questions. We really appreciate it, because I think
Yes.
people have these questions, and this is a great place to kind of get the real scoop on it.
Yes, I totally agree. Yeah.
No, I mean, it really is. So now we've got, now that we're asking the real questions, candles, aromatherapy. I mean, I have people ask me all the time, are there long implications for things that are candles that are 24/7 in my
24/7 might be,
problem.
you know,
All right, fine.
might
That's
be
an exaggeration.
something to consider. Again, I think it's, the moderation of use of those things is probably the important part. Most of the people with issues from candles or oils or Vicks vapor rub is from time to time issues. It's habitual use and really chronic overuse of those things. If you're lighting a candle and you have it on for an hour or two here and there, probably not causing any significant long-term issues. Certainly could trigger asthma. That would be an issue if you have known asthma. But being careful, using repetitively and sort of habitually using those things are going to be.
It's that darn middle path moderation stuff one more
Yeah.
time.
I know, really.
I mean, it really is. Are you seeing a lot of asthma in kids? Is it something that is now environmentally triggered or exacerbated? Are there kids that are more prone genetically to it, or adults for that matter?
Sure, definitely genetic component to asthma, and then you know, a lot of triggers, environmental allergens, or smokes, perfumes, you know, man-made products. A lot of things you come in contact with that could potentially be a trigger. It varies greatly between patients, but usually by the time someone's 20, 25, they have a pretty good idea of things that are triggering them. We see changes in temperature being a big issue, changes in humidity being a big issue, as far as mild symptoms, maybe cough or some wheezing onset from those things.
I was going to ask you, what separates asthma? What is asthma? Maybe that's just the basic question. What is that?
Yeah, we were comparing that to, say, COPD, for instance. It's a reversible obstruction to expiratory airflow. So most people, they are genetically predisposed to it or may have some other underlying issue. But many days they're fine. They're going about their day. They're not having any symptoms. They're not having any cough, shortness of breath, or wheezing. And they come in contact with their trigger, whether it be an environmental allergen change in the season. They wake up and it's a cold snap out, and they're triggered by the cold. They go outside. You take a couple of good breaths in. It's cold air. Your lungs are chronically inflamed, perhaps at a low level or a moderate level. The air triggers those airways to constrict.
Oh, is that what happens?
Yeah, the airways constrict, muscles constrict, and your expiratory airflow is limited. And you may have wheezing, shortness of breath, certainly a issue with that. A cough is a lot of times the only symptom people have. They have kind of an ongoing cough when they're around these triggers. And Those medications will respond generally pretty well or very well to bronchodilators like albuterol. If you have some ongoing significant symptoms, you may need some daily inhaled therapy. It varies from person to person. Certainly worth getting checked out if you're having cough that's problematic, or cough when you're around specific triggers that you recognize over and over. Every time I pet my cat, I start coughing. You probably have a cat allergy and you may have some underlying asthma triggered by
We're
that.
here in the southeast. Mold is a big problem here. Is that a big trigger for people? Yeah.
Huge issue, yeah. A lot of what we see in our practice is people move down to the southeast here from New York or the northern states.
We call them Yankees.
Yankees, yep. The Yankees move down. They've been fine for years or decades even. They get here, the first 9, 12 months, they do fine. And then the second season, they come in saying, I've never had this happen before. I have all these allergies. Especially here in Hilton Head, a lot of detritus on the grounds from all the leaves. There's tons of mold. Everything's always moist, and it really never cools off that much in the winter. We just have a giant organic product burden here. So, the nicest way to say it's an allergen.
That's right.
No doubt about it.
Do you see in the pharmacy a lot of
a ton? Yeah, absolutely. Yes.
Allergies, asthma. At what point does an allergy become asthma and become life-threatening? And I don't know if I even asked that the right way.
I'm sure he's going to address it, but it's the breathing. You can't breathe. That's a life-threatening. That's a 911. I mostly deal with runny nose, runny eyes.
Okay.
Short-term things.
Yeah, certainly. A lot of us have allergic rhinitis, drainage, watery eyes, sneezing. But certainly if you're genetically predisposed to asthma, or you may have some advancement of the symptoms, or you may, say, move your geographic location or your house or something, where you have the trigger that's more constant in your day, and you end up having those symptoms we talked about. The lung essentially gets an allergic reaction, and the airways constrict. And cough and shortness of breath, wheezing perhaps, and a lot of genetic component to the asthma. But certainly you can develop it later in life. Tends to be a little bit more bimodal. We have it when we're younger, in our teens, 20s. It tends to either go away or really moderate, and a lot of people don't notice symptoms through their 20s, 30s, 40s, and they get later in life and it rears its ugly head again.
Interesting. Can you teach people to breathe better? Is there a way to learn to better breathe? Or is there a way, is there good breathing? Is that a question?
A question I get quite often. I think the big important components there are not necessarily how you're breathing, but staying away from inhalants and triggers, and ensuring you're protecting yourself when you're around inhalants, dust, grinding, shavings, construction sites, trying to stay away from a lot of allergens and just inhaled fumes, protecting yourself from cleaning products. So staying away from the things that you're going to inhale that are going to bother you is probably the most important as far as breathing. Probably number 2 on that is exercise, ensuring you're staying in as good a shape as possible. The better shape you are, you're processing your oxygen better, you're able to expand your chest cavity better, you have stronger accessory muscles of breathing. Those are probably by far the most important aspects of that. As far as the pattern of breathing, whether breathing in through your mouth, breathing in through your nose, I don't know that we have a whole lot of data that shows that either of those mechanisms is important. Certainly trying to take nice, good, deep breaths and getting up and exercising routinely is going to keep the alveoli or the air sacs in your lungs nice and open, and exchanging gases better.
Well, Dr. John Daniels, it is a pleasure. We learned a
Fascinating,
lot.
yes.
It really is fascinating. Thank you for helping us. Mind your health.
Thanks for inviting me.
Mind your health, mind your health, mind your health, mind your health.
David Lindsay Ford is here with us today on Mind Your Health to do our mouth segment per your special request. The last time you were here, what did he say? Can we do like something fun and sweet and, you know, cocktaily? And you were like, absolutely, and still make it healthy.
Absolutely.
So thank you for joining us. You got your wish,
yeah,
exactly.
Yeah.
Talk to us a little bit about, I guess healthy drinking is really what we're talking about, or healthy eating.
Yeah.
It doesn't always have to be cocktaily. It can just be something delicious.
Yeah, I find that, you know, sometimes, I mean, water's great, water's ideal, and sometimes that can be boring. And when we think about social events, whether we want to bring something or we want to have something special, I thought today we could do something just a little different. So we can call this a spritzer, we can call it a mocktail, but it can be an alcohol alternative, but it could also just be something that you always have around the house and that you want to sip on without necessarily it being a celebration.
I'm finding that people are more and more and more sober curious, or want mocktails as well as alcohol for a lot of different health reasons. I mean, are you seeing that too?
Absolutely, I agree. Yes.
Yeah.
So what are we going to do today?
So today we are going, just 'tis the season, it's starting to cool down a little bit.
Yeah.
And so I thought we could do something that brings together local ingredients that's very fall, winter inspired. And it's going to be an apple cider mocktail, or we could call it an apple cider spritzer, whatever you desire.
choose. Okay.
Yeah. Yeah, so what we have here, we have apple cider, and this is actually, I got this from Low Country Market and Cafe, and this
Got
is
it.
out in Bluffton off Buckwalter Parkway. And what I love about them is that they always have local ingredients. Now this happens to be considered regional, so this
Okay.
is from Hendersonville, North Carolina.
All right.
I moved down here from there, so when I went in there and I saw it, I'm like, oh my goodness, we have to get it. So this is their apple cider, so we're gonna use this. We have our Savannah Bee Company honey. This is whipped with cinnamon. Now, anytime you see whipped, that means they're adding extra air to it. It's just nice texture, but we're gonna actually infuse a little bit of that in there. We have pure vanilla extract, and this is gonna give it more of like that classic boozy, what's in that drink? I'm curious ingredient. So go ahead and smell this, because pure vanilla extract, when you have a really high quality vanilla extract, it makes a world of difference. This is actually from Jack Frost out in Okatee, which is
love this.
kind of considered more, I mean, they're more known for their ice cream, but I will tell you, their pure vanilla extract is phenomenal. You can actually make your own.
Where did you get this one?
So it's called Jack Frost.
Yeah.
It's out in Okatee off 170 Highway. So Okatee Ale House is right over there. So it's right next to that.
I'm so into real vanilla extract. Well, we were looking at cookbooks before you all were, and I think, oh, there's nothing better than vanilla beans.
Yep, there's nothing better. And this is where, you know, typically you would get the little kind in the little plastic jar.
Yes.
And, you know, it's going to be more expensive, but it's totally worth it. And a little bit always goes a long way.
And what's really interesting to me when we're talking about local ingredients is it really does speak to health and wellness. I don't care if you're in Hilton Head or Santa Barbara.
Yeah.
You know,
Yeah.
there's, this is great.
I think especially true with the honey, you know, where that's done
Yes,
locally.
yes, absolutely. So what we consider would be like regional would be anything within 100 miles. So the more we can consume within that distance, we're probably going to get higher quality, well, at least for us, we're going to get higher quality ingredients. Things are going to be fresher. And it's just always good to support the local community. So
100%.
There we go.
Okay.
Yeah, there we go. And
Let's
then
see.
our last ingredient is going to be Topo Chico. This is not from the Low Country. But what we have here is some nice, this is going to add the bubbles, but I had to go with some Topo Chico. And so what we're going to do is we're actually, I just thought this would be fun just to actually use more of like our mixer, but you could also do this in a mason ball jar and just seal that top and shake it up, whatever you have. So we're going to start off with a little bit of this apple cider.
This would be fun for the kids to make too.
I'm telling you, as far as like a soda alternative, a juice alternative, this is going to be a great option. I typically do this, like if I do this at home, I actually usually use orange juice.
Okay.
And it tastes kind of like a creamsicle. So today we're experiencing something new and different, and yeah. So any 100% juice is going to be.
Talk to me about the sugar. My 7-year-old, Clementine, my 7-year-old granddaughter, mom is like, I think you're eating too much sugar. You're eating too much sugar. And the other night we had like apple cider or whatever.
Yeah.
And she was like, that's got sugar in it, Debbie. I don't know if I can have that.
I mean, I will say anytime you're eating the whole fruit, that's going to be ideal. So anytime we can get that, that's going to be great. I will say when it comes to added sugar specifically, the number one area that we get it from are beverages.
Wow.
And so when we think about the easiest way we can substitute, it would be in our beverages. So what I'd say is common right now are I don't want to poke on Starbucks, but I'm just using that as the example most of us know, are these coffee-like drinks that are loaded with added sugar. And so,
like frappuccinos.
The frappuccino, latte, cappuccino, blah, 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 you know, all those things where it's like, I don't even know what I call it anymore. It's just, you might as well just make your own at home.
Okay.
So beverages is the number one area. So we do have a little bit of added sugar, but we have control over it. So even to your preference, like you could leave some of this stuff out if you preferred. Yeah.
And it's also natural sugar, like the honey is sweetener, natural sweetener, I guess is the better word, instead of, you know, not putting in purified sugar.
Correct. So if I had to pick, if someone were to ask me, hey, Lindsay, what is the best form of added sugar?
Yes.
That, I mean, technically honey is more so considered like a minimally processed sugar. There is still some level, technically kind of processing. I mean, we're putting it in a jar.
Right.
But honey is great. And there are some nutritional profiles to honey. So for people that struggle with allergies, even a little bit, on a daily basis, but you'd want to go more local. I would say there's antimicrobial components, even some, I would say hospitals, if we're talking about, this is totally off topic, but like burn units, for example, there's medicinal honey that can help heal and recover wounds. And so honey has been used for
eons.
Yes. So that's what we've got going on
I've
here.
never seen whipped honey.
I've never seen whipped honey.
Or have I seen? I don't think I have. Do you use it all the time?
I alternate. I usually have different honeys around because we might have something more floral. We might, so depending on where the bees are getting, I mean, they're traveling. And so that's where what's so great about the Savannah Bee Company and what's so great about getting local honey is that they're pulling from, you know, different flora and it's going to change the flavor profiles of the honey. Now whipped is when they're actually adding air. And so it adds another, texturally it can be a little different. Yeah.
But there's not anything.
No.
Okay.
No.
All right. And vanilla, I will tell you that when my son decided he was going through his cooking phase, he's 45 now, he made vanilla chicken. He poured a bottle of vanilla extract in with chicken and then baked it because it was Sarah's night to make dinner. It was ugly.
Okay, yeah.
Oh, it's not good.
Yeah, vanilla is potent.
We've
I
all
was like
been there.
thinking like a little sweet, savory. Okay.
We all sat at dinner like,
Now, and a lot of drinks, mocktails, cocktail type drinks, you might use more like a simple syrup, which is 50% sugar, water. You would cook it stovetop until that sugar dissolves. I'm just kind of going for it today. You can absolutely make a simple syrup and keep it around. So we're just going to add just I really don't want to add.
With your little honey dealio.
I know, I got it just for today. I thought it was just cute. And I'm like, I don't want to get honey everywhere.
I know.
Because it gets everywhere. So we're just going to add that little bit. We can always add more. It's hard to take away less.
Okay. So it's easier to add more than take away less.
Yes.
Does that make sense?
There's also
Perfect.
Yeah, and there's some ingredients like salt. That's a really we can't get rid of salt. I mean that's just in there. So
potato, if you're boiling, you could put a potato in and it will suck up the salt.
Oh,
I knew that.
See, y'all teaching me stuff.
Exactly. That's because we've made enough errors when we've been salting food.
Okay, so now I'm just gonna, and this is one thing, like with the chicken,
Brandon,
right? Like too much. We don't want to add too much, so I'm just gonna add a little bit. Now, I like the smell of that. So yeah, smell that.
Smells good. Scratch and sniff. Mind your health.
So I am gonna shake it. I hope that's
just because that looks cool.
Yeah, it does.
Wait,
it just.
You got that on there?
I know, right? I feel like my thing's broken. Maybe I've used it too much. I'm just kidding.
I love her, but.
Yes.
Yeah, right.
All right. I did not put ice in here because I didn't want the honey to seize up.
Oh, what does that mean?
Well,
Congeals. Lower the temperature.
Yeah.
Oh.
It's like a flash freeze. I don't want to
You're
flash.
such a pharmacist.
I don't want to flash. Yeah.
Yeah.
Isn't that cool science, you know?
Right.
So what we have here.
I love it that you have it in the little.
Yeah, it's fun. And a ball jar would work just great. So.
Okay.
All right, I'm just going to pour a little bit. And this is where I'd say at home, don't drink it yet.
Gotta have the Topo Chico.
We got to add the sparkle, the bubbles.
Kind of want mine straight up.
I know, right?
Oh, this looks good.
And I would say even...
But you can do this, you said, with... Look
okay.
at you.
Yeah, they're roughly even.
Oh, are you that kid?
I'm that kid. I'm that kid. I'm like, oh, man.
See?
I didn't do it.
Oh, it's because it was in the car.
Well, this is good, though. I would say go for it.
We're going for it.
See? I knew I had that for a reason.
Yeah.
All right, I'll tell
There we
you,
go.
you pour.
Yep. All right, so, this happens at home, too. And we didn't get it in the vanilla extract or the honey, I don't think, and that's fine. All right, so we're just gonna
Don't mind me.
finish it with a little bit of the bubbles.
That actually does look good with bubbles.
And, you could always put a cinnamon stick in here, just kind of different, or I would say apple slices would be really nice.
Oh, apple slices would be great. But if you're doing it with orange juice or some of the other juices, that could be really good.
So you could turn this into, it's refreshing regardless, but you can kind of turn it, and we'll do a little more.
Come on. Look at LaFred's like, yeah, cheers.
World
Cheers.
peace.
Cheers. World peace. Hi, Betty.
It's just really light.
Ooh, it's good.
Yeah.
And
Yeah.
And usually I'm like,
It's really light. We could always go with a little bit more apple in there, but that's what we want. We don't want anything too over the top. Yeah.
That's delicious.
Yeah.
So again, bon appetit.
Bon appetit.
Bon appetit.
Thank you.
Bon appetit. And mind your health.
Mind your health, mind your health, mind your health, mind your health.
We are here on Mind Your Health with our friend Heather Quinn. David, I'm excited about this.
Me too.
And with 3 little girls to feed every day and school in session, I can imagine lunches can be quite challenging.
Yes.
And in talking about what you do, we thought it would be fun to share with our viewers some of the creative things you do to give healthy lunches to your kids that they really like.
Well, thank you. My biggest challenge is I have picky eaters, and social media can get a bad rap, but I use social media all the time for lunch hacks, and this is one of my favorites. It's salad in a jar. So with my picky eaters, I've found, deconstructing anything is the way to go, because then you're not cooking 5 different meals. You can kind of just separate to what people like. So this is salad in a jar. So Debbie, I'm going to have you help.
Got it.
And the key to this is so that things don't get soggy, you put the dressing in first. So I'm using ranch.
And of course we're using ranch because that's what all the kids like.
But you can use
How much do
a
you put in?
vinaigrette. I just kind of cover the bottom of the jar.
Okay. I will say that Heather's pretty good at this. She's a sourdough bread maker too. And she has a giant sourdough thingy thing back here that she continues to make deliciousness from.
Well, it's really not that great. I just forget it. It lives on its own.
I know, but mine died in the fridge. It was very sad. I killed it.
So next you're going to want to do just kind of like your firmest veggies. So I always kind of start with cucumbers.
So wait, firm veggies for, for SOG protection.
Yeah, SOG protection as they
like
go
that.
everywhere.
Well, I know these are your faves.
Yes.
I'll put the...
I'm not using my hands. Go ahead.
Oh, I can't... Oh.
And so sometimes my kids also too like to eat, you eat with your eyes. So I find with kids too, like they like this because you can see what's in the jar.
Yeah.
One of my girls calls it like a rainbow salad.
My God, I'm so messy. I'm so sorry.
So then let's do carrots. You can kind of layer it however you want. So if you want to do carrots.
Carrots next. Do you like carrots in your salad?
I do.
Me too.
Peppers.
I love how she cut them all up into like perfect little squares.
Well, you do have to chop things up kind of fine to fit in these mason jars. You could do it in a bigger jar if you wanted.
Now, will you do a protein in these too sometimes?
So I will. So David, today we're doing vegetarian. So we've got chickpeas, which is one of my favorite kind of meat alternative for protein. And you'll just put them in there and drain them and rinse them. But a lot of times too, this is great for leftovers. So if we have a taco night, we can do like a deconstructed, you just start with rice.
And really, yeah, I love this.
And do you like tomatoes?
Yes, please.
Okay, because some people don't. So that's the other thing. You can kind of make it how you want it.
And then does the salad go, I mean, the lettuce go on the top or the?
So then the protein's going to go next.
Oh, protein next.
Yeah,
Okay.
and you leave the lettuce for the end because you don't want it to get soggy.
I do love a good chickpea. Oh, look. Oops.
Yeah, I do love chickpea too. I
You
didn't
love
discover chickpeas until like a couple years ago.
Me either. I use them on my salads all
Yeah.
the time, and I love them.
Okay, so now on the top, you just put a little bit of lettuce.
Ooh, this looks good.
And you don't want to jam it in too much. I find kids too, they don't like a ton of lettuce. They kind of like all the
need
other
to stand in
things.
front of
That's
you.
all good.
And then you just put the
Or
top
did I?
on.
Hold on, wait a minute.
Debbie's having lettuce trouble.
I have cucumbers and lettuce,
This place is a disaster.
and I'm supposed to be good at this. All right, what do I do?
And then just put
Okay.
your top on, and then you'll just put it in the lunch like this. And then
Okay.
when they get to lunch, they can shake it up, and you have a fully dressed salad.
I mean, I think this is such a great idea.
Do they refrigerate it?
So I put a cold pack in my kids' lunches, but I make these all the time for myself. I think it's super easy. I really don't like making salads for myself, so I find this is a really easy way to just have it in the fridge. And as long as you put the dressing at the bottom, you shouldn't have any problem. I mean, it should live in the fridge like this for a couple of days.
I was just going to say, you could really make salads for a few days, and like you said, with turkey.
And
any
I've
other
done it with
protein.
chicken. And like I said, you can do it with leftover meals. So we always have tacos on Tuesday.
Okay.
So like tomorrow you could just, layer the rice, the beans, and the meat at the top and lettuce, and then you have a little taco bowl.
I think this is ingenious.
I like that, yes.
Yeah.
Absolutely ingenious. And just one more way to
Mind your health.
Mind your health, mind your health, mind your health, mind your health.
David Burke, Mind Your Health was wonderful today. I thoroughly
Great
enjoyed
day.
it. Did you have favorites?
I did. I liked obviously the pulmonologist was
Yes.
good, great information. I liked pharmacist Ryan with the compounding. That was great.
I thought it was amazing. I learned a lot from Ryan. There's a lot I didn't realize that pharmacists do, and their education is unbelievable. Tanya was great talking about fascia and how important that is for inflammation. I enjoyed that too.
And more importantly, how it affects your entire body. Every muscle is connected with the fascia. So that I had never thought about that before.
Exactly. We had Celia too, who was talking to us about just overall movement and general health and wellness. And not to be forgotten, Heather with her salads. For the jar salads were amazing, and Lindsay came in and showed us an autumn cocktail. So once again, Mind Your Health is a wonderful place to be.
Please like and subscribe to us on YouTube and follow us on social media at Mind Your Health Podcast.